long axis distraction for the knee joint. So you're gonna have your patient into not full like 90-degree flexion, and then more of like relaxed position of the joint, which is 70-degree-ish of the flexion, right? And then depending on your patient size, you can pin down with your hand, and then you can grab better. I think I can grab like that way, and yeah, distraction, and then pin down, right? And you're gonna distract the joints like that way. It's same thing like the shoulder. You don't have to like the pull like this way by your arm muscle. Like you're gonna hold down to it, and then you're gonna rotate your body away, like that way. So then you can actually distract the joint, right? So that's the way. Or like if your patient has the too much of like long and big muscles here, then you may need to pin down with your leg, which is not recommended during the exam. Okay? The best way you can do is try to do this one. But with my patient, usually when they, there are most of the people are way bigger than me, right? Like his size, I have those patients too. So then I have to put my leg up here and then like do this traction like that way. It's easier for my body, but not during the exam. I told you, not during the exam. Okay?
Would it be easier in supine doing that one?
So,
supine like this, and then you just fall.
That's more of like anterior glide of the tibia on the femur than the long axis distraction of the tibia. So like any patient with the meniscus tear injury or like OA, kind of the patient need a distraction of the knee joint, then this is the way that it is.
Can you perform for the extraction?
Yeah, so can I have you two facing up now?
Yeah.
So, like you're gonna have your patient leg into the little bit of the relaxed, right? And then depending on your target is, the femur position is changed. If you wanna distract lumbar or sacrum, actually you need to lock their patient hip joint and then do the distraction. Then it's gonna go straight to their SI joint or the lumbar area. But when it comes to the hip joint distraction, you need to open up their hip joint and then like relax the position here. And then you're gonna use your body to rotate. So gripping here, or if you feel like easier holding like this and then against your body, that's possible too, but you may need a barrier in between, right? So you can hold down like this way and then pull it. And another thing that you can do for the OA at the hip is the lateral distraction actually, because like the hip joint head is going like this way, right? So when you do the long leg distraction, it's like this, long axis distraction is like that way. But actually like a gapping, lateral gapping is actually spacing out from the acetabulum from the straight, bring it out the head of the femur from the acetabulum kind of the way. So you can perform the lateral distraction. So you need a towel on your shoulder, and it's easier for you to have your patient leg onto your shoulder, and then you're gonna go close to the inner thigh. So you need to get a consent from your patient and your catheter. And then you're gonna perform, like you're gonna bring the femur out from the range. So sometimes I have to hold the leg like that way, so I can have the better movement that way. And sometimes I need just one hand to actually push out. So depending on your patient side, right? Is there anything else?
Good thing I passed that one.